Thank you very much, Dr. Hall, for your presentation. And now we would like to invite you to the planned panel session that is going to be held in 10 minutes at 2:30. So you also please have some time to share your questions, prepare your questions, share them with us so we can ask our speakers. And we also would like to kindly ask our speakers to get ready, get prepared, and turn your screen on. So we will be looking forward to seeing you in 10 minutes. Thank you. Welcome, everyone. I would like to also welcome our speakers. Welcome all at the panel session that is going to be traditionally coordinated by Dr. Kreider. And I guess that we can move to our first question, which is going to be for Dr. Kristen Drescher. Could creatine serve as an adjuvant in management of food allergies? I think you're muted. I'm sorry, Dr. Drescher, if you can unmute.
Okay, there. I think it would be contraindicated in the case of food allergies. From the standpoint of an immunologic response, it would be considered an anti-inflammatory or a Th2 response, which would be the way that creatine is pushing the immune system from what we've done.
Thank you so much.
You're welcome.
Thank you very much. Another question is actually also for you. For a person with a non-symptomatic positive ANA test result, it might be a good idea to offer creatine as a preventive strategy for some immune disease.
Okay.
Is that true?
And a positive ANA is not in and of itself diagnostic. But a lot of diseases associated with a positive ANA are going to be antibody mediated, which is going to be your Th2 response. So I think it would be contraindicated. You would want something more pro-inflammatory. Rheumatoid arthritis is sort of the disease I have my eye on.
Thank you so much. Thank you very much. Another question is going to be for Dr. Lily Yang. Could creatine interfere with chemotherapy in a person with bone cancer or any other type of cancer, please?
Yeah, that's a very good question. So in the study we have done, we use the animal tumor models. We used 2 animal tumor models, one for melanoma, one for colon cancer. Now we are actively expanding our study into the other cancer type. Like we haven't really done the model, like modeling the bone cancer. So I do not have information directly comment on that. However, for the anti-cancer immunotherapy, there are many things in common, like how the T cell interact with tumor, interact with tumor microenvironment. It's some key, elements are shared between the cancers. So I would not be surprised that we will see a similar, like beneficial effect if we, study the particular, another particular cancer model. But the experimental evidence now is not available yet.
Thank you very much. Thank you for your answer. Another question is to all of you, please. So if creatine is helpful for many clinical populations, why is this not standard practice? For example, if an older adult is admitted to the hospital for care, why not provide them with creatine, just like any medication that is given?
Dr. Balestrano or Dr. Hall, as MDs, would you guys like to give that a shot?
Well, I can start first, if you don't mind. That's a good question. To fully understand why is that, I think we should realize what is now regulating the prescription practice for standard medications, which is the so-called evidence-based medicine. Now, evidence-based medicine means that a medication is accepted into routine clinical practice only after very extensive proof of evidence, proof of effectiveness has been given. And when I say very extensive evidence, I mean randomized controlled trials enrolling thousands of patients. So each of the medications we standardly prescribe to patients has gone through a lot of clinical development, including, as I said, randomized controlled trials, which usually include thousands of patients. Now, all that, as you know, is very expensive, and only when, of course, not everybody can do that. Now, the fact concerning creatine is that probably nobody will ever have the interest, the commercial interest, nor the means to spend so much money on randomized controlled trials. So probably when we speak of on what basis creatine is recommended or prescribed, we shall reason in a very different way. So what we say in when recommending creatine or prescribing creatine is that even if we don't have that huge amount of evidence at our disposal, we still have the evidence we reason about every day, like we did today in this meeting, and like we all are doing in our research and publications. So when we recommend creatine, we stress one, that it is a safe supplement. I am personally convinced of that, and I have written of that. Creatine is a very safe compound, with the possible exception of people already having a kidney damage. Everybody else can safely take creatine. I usually quote the studies that was done on Parkinson's disease when they administer the creatine at a dose of 10 grams, at the average dose of 10 grams a day for 5 years or more in Parkinsonian patients, and they found no difference of adverse events compared to placebo. So that's the best evidence, at least the clearest evidence we have that creatine is safe. So number one, creatine is safe, and number two, creatine indeed does have a lot of evidence, which is the evidence we speak of every day and we discuss today. So my answer, and I'm sorry for having taken so much to arrive at this simple answer, is number one, that creatine will probably not be prescribed in a formal way and reimbursed by insurances until we do have randomized clinical trials involving a lot of patients. And I wish we will have those trials soon, but I'm not sure that we will have them. But we are still able to recommend and prescribe creatine as a dietary supplement because one, it is safe, and even if we do not have that amount of evidence, we still do a lot of evidence, as a person who asked the question certainly realized. And this is a reason why we do prescribe and recommend creatine. I'm sorry to have taken so long. I hope I was clear, and I let anybody else answer too if they wish.
Dr. Hall, anything to add?
I agree that it is very difficult to get clinical trials on any sort of nutritional supplement or any sort of vitamin and those kinds of things, because pharmaceutical companies have less to gain from those things than as compared to other medicines. And so just getting all the testing is trickier. And so in the hospital, I think that it's pretty rare that we use nutritional supplements in that kind of acute setting. I'm a pediatrician, and so it's even harder to get studies done in pediatrics as compared to adults. So it's tricky. It's tricky to get those kinds of studies done. I think that, and I'm sorry I didn't get to attend the full session today as I am in the hospital seeing patients, but I do think that this evidence that people are gathering is really important to argue for the use in these different disease processes. And, you know, I think I'm still at the beginning when it comes to inflammatory bowel disease, but potentially moving forward, it could be something that could be used as an additive for therapy.
Thank you. And I will add that, you know, from my experience of doing this for 30 years, being one of the first to start doing it, you know, our medical training isn't really focused as much on nutrition. It's more on treatment and pharmaceutical applications and treating the disease. And I think we have to improve our medical education to include nutritional practices and things that may actually help with rehabilitation and recovery, and really focus on that. And the whole purpose of this conference really was to increase the awareness, especially in the medical communities, about the role of creatine in metabolism and health throughout the lifespan. And that's, we have to get the word out that there are some applications. And I know from personal experience with family members that had cancer, you know, talking to the physician and giving them the evidence about some nutritional strategies, it was all new to them, and that they're one of the leading cancer physicians. And so I think we have to do a better job educating, and we also have to provide the evidence and do the studies so that there's some confidence that the recommendations are made can have some impact.
Thank you very much for your patience, and we apologize. We had some technical issues. We ran out of pottery and microphone, but we are back. So another question was for Dr. Lily Yang. Can please PD-1 plus creatine kill the tumor only at the early stage when the tumor is barely recognizable? Or could it also be applied at a more advanced stage? Thank you.
And that's a very good question. So like in our study, we tried the different conditions. We tried to give the treatment at the early stage. We tried to give the treatment at the later stage. As one may expect, that give it at the early stage always give you the best results, right? It's similar as the checkpoint inhibit, treatment alone, like anti-PD-1. You give it at the early stage, you caught like the early, development stage of tumor, also the immune reaction, that you get the best results. We did, it's not, showing at the presentation today, but we did, performed the study at a quite late stage when the tumor grow, pretty big, So at that stage, we observe still a certain effect, so actually it's nearly comparable to the single treatment of the anti-PD-1 alone. The effect is not as dramatic as the one like giving at the early stage. You see some delay of the tumor growth, but the elimination become more and more challenge when the tumor, advanced along the time. So I would say like any other treatment, like give it at the early stage, or like for the cancer patient, maybe give like right after the chemo, treatment surgery, when the tumor load, is at minimal, like then you may expect the best therapeutic effect over that.
Thank you so much for your answer. Another question is for Dr. Maurizio Balestrino. In people with heart failure with symptoms of fatigue and weakness, without kidney failure, but with a history of kidney disease, could creatine be recommended, please?
Yes, thank you for the question. And the answer is yes. As I said in my presentation, there is evidence showing that in heart failure, creatine supplementation not only may increase the strength of contraction of the myocardium, but also improves the function of the skeletal muscles, and so mitigates the sense of fatigue and general weakness that these people have. So for the reasons I discussed in my presentation, the answer is definitely yes, of course, yes.
And I will add, tomorrow we're going to hear a presentation on the role of creatine in treatment with chronic kidney disease and dialysis. And so I know that some physicians are a little concerned about an increase in blood creatinine as an indication of maybe some stress on the renal system, but other studies by Jacques Portmans and others have shown that not to be effective. They actually are using it in patients with kidney disease that are getting dialysis to help with management of homocysteine and other factors related, because it appears that creatine, there's a greater need for creatine in those states. So I'll be waiting for tomorrow to hear some more about that.
Yes, if I may add, I agree with what you said. My statement that creatine may be not indicated in people with kidney damage is a caution statement. I mean, there is no evidence right now that creatine worsens kidney damage, but this is a debated field. So my recommendation in that sense is just for staying on the cautious side. It's not a definite proof or evidence that creatine does worsen kidney damage.
Thank you very much to both of you. Another question is for all of you, please. We have definitely established the safety of creatine. Are there any contraindications with creatine with specific medications or autoimmune disorders, please?
I'll answer part of that question. I think in individuals that are prone to severe allergies, creatine would not be indicated. I think in individuals who have chronic inflammatory conditions dominated by a Th1 response, it would be helpful.
Yeah, I would add that we've done many safety studies, but we're doing a very comprehensive assessment of the literature now. And there are very few mentions in any study that's been done to show much of any side effects. And in fact, a lot of the studies even had asthmatics and other type of folks in the protocols, because athletes, even competitive, highly trained athletes, often will have some of those issues. And so I don't know of any study showing any contraindications as far as an interaction with the medication. Of course, the more and wider spread it would be, we have to keep our mind open and keep an eye open for those things. But there's nothing in the literature that suggests that there's anything that I'm aware of.
Yes, I also agree, and I can confirm what you said.
Thank you very much. Thank you, all of you. Another question is for Dr. Holly Clark. Some people frequently ask about the effects of creatine on hypersensitive population. Could you please tell us the conclusions of current evidence about this? Thank you.
So the hypersensitivity of people to creatine, I guess this is what's going the question. We do know that there are some people that don't respond to creatine, so non-responders, same as with exercise as well. I haven't actually heard of hypersensitivity before. Maybe that's a new term that I need to look at. But I would assume that most people taking creatine would have some of the improvements that we've shown throughout this conference. Am I still being heard? I don't know what's going on. So yeah, I would just, oh, yep.
We were hearing you. I think you can go on speaking.
Okay, yeah, I just saw like a bunch of changes, so I just make sure. But yeah, like I said, I'm not too sure about the hypersensitivity per se. I do know about the people who are non-responders. But yeah, I would recommend people to take creatine for lots of different areas, and most people would respond with the positives that we outlined throughout this conference.
Thank you, doctor. Thank you so much for your response. Another question is for Dr. Hall. What are the potentials of creatine to wound healing? Do you see any potential of putting creatine into creams or lotions?
Well, that's an intriguing idea. We were able to show increased wound healing in the decreased wound healing in the setting of creatine transporter loss, and increased wound healing when you overexpress the creatine transporter, which suggests that enhancement of the creatine pathway very well could allow for better cell mobility and proliferation in the setting of wound, in the setting of a wound. And so providing it locally, I think, has some rationale. Yeah, I think that has some potential. I haven't tested it directly, though.
Yeah, I'll add in our overview paper, the first paper that Jeff Stout and I wrote, there's a section on the role of creatine in skin health. And there's actually been some studies where they put creatine in ointments to help reduce wrinkles and things. And the skin evidently has a capacity to take up creatine and improve the energy availability. So when I saw your wound healing data, it was very intriguing, both by taking it orally, but potentially be a great study to do to see if there's any speeded up healing if it was in a salve or something. I think that'd be a fascinating study to do.
Yeah, really interesting suggestion. Yeah.
Thank you very much. Another question, please, is to all of you. Is there any risk with creatine supplementation when the person has cardiovascular risk due to heredity and lifestyle?
I missed the first question, the first word. When a person has what risk factors? Could you please repeat your question? I missed one word.
Yes.
The risk factor, which was the first risk factor you mentioned?
So I believe they asked about cardiovascular risk factors. If the person has cardiovascular risk factors, whether or not they should or shouldn't take creatine.
Well,
since I heard the question, I'll go ahead and answer, and then maybe you all can provide some. No, there is no rationale for a person that is high risk to heart disease or might have high cholesterol or hypertension. That's one of the reasons why you'd want to take creatine, because it can not only improve energy bioenergetics and mitochondrial activity, but everything from vascular system to potentially a protective effect on the heart during ischemic conditions, to helping control glucose and maybe with some diabetic management, cholesterol. So you mentioned Dr. Ernest's first study. That was one that showed this, and we did a study, similar response. And so there's a lot of benefits that if you are a person with high risk to heart disease, getting active, getting fit, exercising, and applying some basic nutrition, including creatine, could actually help you in many ways.
I do agree fully. And if I may add just one quick note, This goes back to the previous question that creatine actually has no contraindication as far as we all know. So I fully agree with what you said, and I also agree that no, there is no contraindication in that kind of people.
Thank you very much. And our last question, could it be a better option to administer micronized creatine in patients with IBD? It's to all of you.
Did everybody hear the question?
Yeah, it was, I was guessing it was partially directed at me since I spoke about IBD. I think delivery of creatine is still a little bit of a question mark about how best to deliver it to the site of inflammation. And if it matters, if it's delivered to the mucosal lining versus absorbed and then distributed throughout the body, I think that's relatively unknown. I think we do know that the epithelial cells or the lining of the digestive tract is capable of taking up creatine and using it directly. And so in that way, it does seem like that would be helpful to deliver it directly to the intestinal lining. I don't know about bioavailability after going through the digestive tract. I don't know that data, but I think that it's something that requires further evaluation.
Dr. Ralph Yeager tomorrow will go through all the literature on bioavailability of creatine. And so you'll see some of that data, but it's a fascinating question. So let me ask a few questions also, because I've been dying to talk to you folks after reading the papers you had. Dr. Lily Yang, if creatine is important in the initial stages of tumor development and helping maybe retard some of that growth, should it be a prophylactic type of approach that if you have the 3 grams per day, as we talk about for just general health, would that potentially have some protective effect?
That's a very fascinating question, right? So like in the study, like we performed, we did try the preloading, stage for the creatine. So like we pre-treat the experimental animals with creatine, supplementation, and then we challenge tumor later on. So turned out like, again, the earlier you give the supplementation, the more significant effect you'll see. So when I see this, when comparing, like you gave the supplementation, say 3 days before the tumor challenge, versus you gave the supplement at the day of the tumor challenge, or compared to you gave them like, 5 days later when the tumor challenge. And guess what? The earlier you gave to it, the better the results will be. So I would, agree with your comments, like, early, like preloading the body, with or constant uptake of the good amount of the creatine will prepare the immune system already in a good, like better condition to fight cancer when the cancer, at the time they arise. So like the prophylactic treatment, prevention of the tumor occurring, that's a fascinating idea. I think it need some more, more like different, like the tumor model to say spontaneous generating tumor model, right? So you compare, like some animal you always gave creatine supplementation, before that they even develop tumor. And another group, they may have the same chance to develop a tumor, but you don't give the creatine supplementation. So that type of experiment will best answer, like the prophylactic treatment value, for the preventing, like the tumor occurrence, or reduce the risk of develop cancer, right? We all want to know the answer. So that type of study, we are planning, to do, but I haven't got the results yet.
Thank you. I guess if you had animals with a diet high in creatine for their lifespan versus groups that had normal dietary availability, you might then be able to implant a tumor or something and see if there's a different response. That'd be a fascinating study to do.
That is a interesting, setup too. Yeah, great. Yeah, the spontaneous or implanted, tumor, like the spontaneous developed tumor, usually considered to be more like physiological, relevant. So data from those will, kind of add some additional value, compared to the implanted tumor models.
Okay, thank you. So, Dr. Drescher, I have a question for you. Given the potential role in immunity, you mentioned some areas and types of immunity there might be some enhanced. Can you apply that to a person that's starting to feel sick? Is there like a zinc type of thing that you can provide and maybe lessen the severity? Have you thought about some of those type of practical applications?
I've mostly thought about it in the context of autoimmune disease, because that's what I was trained in. But I think that if you had a condition that was driven by an antibody response, that creatine would definitely be worth trying. And most of those are going to be autoimmune in nature. I mean, there are some infectious diseases where the pathology is related to antibody production, and that those drive pathology. So I think they would be helpful in those situations, maybe.
Thank you, fascinating. And then Holly, I have a question for you. Your dissertation was phenomenal, very nicely done. You did a great presentation. And I'm wanting to know if you've compared the impact of creatine to flow-mediated dilation and some of the markers you've done to other things that might affect nitric oxide. Have you thought about comparing or doing some synergistic additive things? Can you give us some background on that?
Yeah, for sure. Yeah, great question. My dissertation was unfortunately hit quite hard by COVID. So there's definitely more that I would have liked to do with it. And that's something we are going to continue with. So one of the main things we do want to do is actually look at a control group as well. So try and compare the improvements that these older adults and make sure that, that young, healthy, fit males won't have a similar response. So that's definitely one aim we want to hit. In regards to the nitric oxide, that's a great question. One of the reasons why I didn't measure nitric oxide is because I know it's difficult to measure in blood, and you're not really measuring nitric oxide, you're more so measuring nitrate. So that's why I chose that kind of novel BH4 biomarker to look at, because it was still connected. But I would like to go back and possibly, if possible, I would love to inhibit the nitric oxide to see whether or not that, obviously the dilation will be blunted, but whether or not that blunting is less because of the creatine. So that way, perhaps creatine is contributing to those EDHFs, like I said. But yeah, we haven't really talked about that much yet, but that's something I would definitely like to do. We are moving forward more so with the antioxidant portion of creatine, because we didn't find much mechanisms in regards to my dissertation. So now we're going to focus upon that microdialysis with the direct perfusion of creatine. The good thing about microdialysis is we can actually measure blood flow as well directly. So not only will we look at the ROS potential, but also the blood flow. So it's really interesting stuff that will hopefully be coming out of our lab within the next few months or so.
Fascinating, thank you. And then Dr. Balestrino, I've been very interested in the potential prophylactic use of creatine before having surgeries that might affect stroke or heart, where there may be a greater opportunity for a heart attack or things like that. Can you comment on some of that data, even though some of it's in animal data? Can you talk about maybe that if you know you're going to have surgery, maybe it's a good thing to get people to take creatine?
Yes, that is a very interesting field. The fact is, there are data that show that creatine can be a prophylactic treatment, as you said, to decrease the damage that is inflicted on the brain by a stroke, for example, ischemic stroke specifically. So there is a very relevant amount of animal data showing that if you if you supplement the animal with creatine before subjecting it to a stroke, the final damage will be decreased. And I especially remember a paper by Theo Wallimann now a few years ago, which showed exactly this that I just said. And interestingly, he found that a lot of the creatine effect was due to a beneficial effect on the arteries, not only on the brain tissue, but on the arteries. So I think there is a rationale for giving creatine as a preventing measure to people who are at high risk of stroke, of ischemic stroke. And I can think, for example, of people who have had a transient ischemic attack, who have a high risk of stroke in the following days. People undergoing heart surgery, like bypass surgery, who have also a risk of stroke, especially certain categories of people undergoing heart surgery have a high risk of stroke. So this is actually something that should be studied in clinical trials, which unfortunately so far we are missing. Also in people wanting to do so, creatine can even now be administered because animal data are there to support this hypothesis. And as I said, creatine is very safe even in people having risk factors for stroke, vascular disease, and what else. So again, the answer is definitely yes. And I wish there were more clinical trials, but even now we can recommend creatine to people in those conditions.
So last questions for Dr. Hall. Thank you. That was very interesting. You had a case study with Crohn's disease that I found fascinating. And obviously a lot of people have Crohn's. And you basically was a case study where there was withdrawal and resupplementation, and you saw worsening and then improvement. Are you aware of any other studies that have looked at Crohn's with creatine? Is this another area that really needs to be studied that has potential?
Yeah, so Crohn's disease is one arm of inflammatory bowel disease along with ulcerative colitis. And right now, our current plans regarding the clinical trial are focused on ulcerative colitis, as our mouse model was more of a model of colonic disease and more fitting with ulcerative colitis. But I do think that those same findings that we had in regards to barrier function and wound healing would apply to both diseases. And so I think that, you know, that would be something that would require further investigation, but the rationale based on the tissue culture and the mouse model is there. And so it would just be bringing it to that clinical study, but absolutely, I think it has potential.
Well, I'd like to thank our speakers for some fascinating presentations, and this just illustrates that creatine's gone beyond sports supplement, and now there's potential health, really important health benefits that are starting to emerge. And so I thank you for your papers and your contributions from all your colleagues that have been working on this area, and that has opportunities for much more research down the line that really can impact on human health. So thank you very much.
Thank you.
Thank you.
Thank you.
Thank you so much. Thank you very much to all of you, to our presenters, attendees, to everyone who has attended and learned with us today. It's been, again, an amazing day, and we would love to invite you to join us tomorrow for the last day of conference, which is going to be, again, packed with a lot of interesting topics. Let me just mention a few of them. For example, timing of creatine supplementation around exercise, relationship between dietary creatine and growth, indicators in children and adolescents, or something we all definitely are going to like, common myth about creatine supplementation. So thank you very much for everything. We deeply appreciate you being here with us, and we will be looking forward to seeing you tomorrow. Thank you.
Thank you.
Thank you. Bye.
Bye.